Greetings, dear viewers. You've tuned into Brainetainment, your one-stop channel for all things intriguing and enlightening. Here at Brainetainment, we believe that learning should never be a chore. That's why we strive to make every video a blend of knowledge and fun, covering a wide array of topics from the mysteries of the universe to the intricate workings of our bodies. Today we delve into a health topic that affects many yet remains widely misunderstood: endometriosis. So stay tuned as we unravel the mystery. To begin with, what exactly is endometriosis? A question that has puzzled many yet remains essential in understanding women's health. Endometriosis, derived from the word endometrium, which is the tissue that lines the uterus, is a rather complex and often misdiagnosed condition. In a typical menstrual cycle, the endometrium thickens in preparation for potential pregnancy. If no pregnancy occurs, the body sheds this tissue through the process we know as menstruation. However, with endometriosis, tissue similar to the endometrium develops outside the uterus. This could be on the ovaries, fallopian tubes, the outer surface of the uterus, and even on the lining of the pelvic cavity. Now you might be wondering, what's the fuss about? Well, the problem arises when these misplaced tissues continue to act as they would if they were inside the uterus. They thicken, break down and bleed with each menstrual cycle. But unlike the tissue inside the uterus that leaves the body during menstruation, the tissue outside the uterus has no exit route. This results in internal bleeding, inflammation and scarring. Over time, this can lead to the formation of adhesions and cysts, causing severe pain and potentially leading to fertility issues. While endometriosis primarily affects women in their reproductive years, it can also occur in girls as young as 11. It's a condition that's far from rare, affecting an estimated 1 in 10 women worldwide. Despite its prevalence, endometriosis is often misunderstood and underdiagnosed, with many women suffering for years before receiving an accurate diagnosis. In essence, endometriosis is a disorder where tissue similar to the tissue that forms the lining of your uterus grows outside of your uterine cavity. It's a condition that can drastically impact a woman's life, causing not just physical discomfort but emotional distress as well. Now that we understand what endometriosis is, let's delve into its causes. The journey to understanding endometriosis is far from over, but with knowledge comes power. The power to raise awareness, promote understanding, and ultimately improve the lives of those affected by this condition. The exact cause of endometriosis remains a conundrum. However, several theories could explain why it happens. One of the most widely accepted theories is retrograde menstruation. This is when menstrual blood containing endometrial cells flows back through the fallopian tubes and into the pelvic cavity out of the body. These displaced endometrial cells then stick to the pelvic walls and surfaces of pelvic organs, where they grow, thicken, and bleed over the course of each menstrual cycle. Next, we have the transformation of peritoneal cells theory. It's suggested by some experts that hormones or immune factors promote the transformation of peritoneal cells, cells that line the inner side of your abdomen, into endometrial cells. Another theory is embryonic cell transformation. Hormones such as estrogen may transform embryonic cells, cells in the early stages of development, into endometrial cell implants during puberty. Surgical skull implantation is another theory worth mentioning. After a surgery such as a hysterectomy or C-section, endometrial cells may attach to a surgical incision. This is quite rare, but it has been observed in some women. Lastly, there's the theory of an immune system disorder. It's possible that a problem with the immune system may make the body unable to recognize and destroy endometrial tissue that's growing outside the uterus. These theories provide a glimpse of the possible causes of endometriosis. However, it's important to note that none of these theories fully explain why endometriosis occurs. It's likely that the condition is the result of multiple factors converging, and these factors could be different for each individual. Therefore, the precise cause of endometriosis is still a topic of ongoing research. Scientists are working diligently to unravel this mystery in the hopes of developing more effective treatments and ultimately a cure. Despite these theories, the exact cause of endometriosis remains unknown, but what we do know are its symptoms. The symptoms of endometriosis can vary greatly from one individual to another. Some people with the condition might experience severe symptoms, while others might not have any noticeable symptoms at all. However, there are a few telltale signs that are commonly associated with endometriosis. One of the most common symptoms is painful periods. This isn't just your typical menstrual cramp. It's pain that's far worse. It can start a few days before your period and extend several days into your period. It's not just in the lower abdomen either. It can radiate to your lower back and pelvic area. Another symptom is pain with intercourse. This pain can be during or after the act, and it's typically described as a deep pain as opposed to a surface pain. It's important to note that any pain during intercourse is worth discussing with your healthcare provider, as it's not something you should have to live with. Pain with bowel movements or urination is another symptom that can occur, particularly during your period. This can be due to endometrial tissue growing in or affecting the bowel or bladder. Excessive bleeding is also a common symptom. This can mean heavy periods or bleeding between periods. And while it's normal for menstrual flow to vary from one person to another, it's not normal to change your tampon or pad every 1 to 2 hours because of heavy flow. Infertility is another symptom associated with endometriosis. Some people might not know they have the condition until they try to become pregnant and have difficulty. In fact, endometriosis is one of the leading causes of infertility in females. Other signs can include fatigue, diarrhea, constipation, bloating, or nausea, particularly during menstrual periods. It's important to remember, though, that these symptoms can also be caused by other conditions, which is why it's so important to get a professional diagnosis. If you or anyone you know experiences these symptoms, it's crucial to seek medical advice. But what happens when you do? Let's talk about the treatments. While endometriosis can be a challenging condition to live with, there are treatments available that can help manage the symptoms. Let's delve into the realm of treatments for endometriosis, shall we? It's important to note that while there's currently no cure for endometriosis, these treatments can significantly improve the quality of life for those affected. First off, we have pain medications. Now, these aren't a long-term solution, but they can provide temporary relief from the discomfort that often accompanies endometriosis. Over-the-counter pain relievers such as ibuprofen can be effective, but sometimes prescription painkillers might be necessary. Next up, we have hormone therapy. This is often a more effective way to manage endometriosis, as it targets the root cause of the condition. Endometriosis is driven by the hormonal changes of the menstrual cycle, so by regulating these hormones, we can often reduce the severity of the symptoms. There are several types of hormone therapies available, including birth control pills, progesterone therapy, and gonadotropin-releasing hormone agonists and antagonists. Conservative surgery is another option, particularly for those who wish to become pregnant or for those whose symptoms aren't managed with medication. This type of surgery aims to remove or destroy as much endometriosis tissue as possible while preserving the uterus and ovaries, maximizing the chances of a successful pregnancy. For those struggling with fertility as a result of endometriosis, there are fertility treatments available. These might include controlled ovarian stimulation, in vitro fertilization, or using donor eggs. However, it's essential to bear in mind that these treatments all have their own potential side effects and risks. For example, hormone therapy can cause a range of side effects from mood changes to hot flashes. And surgery always carries risks, such as infection or damage to nearby organs. Furthermore, what works best will depend on a number of factors, including the severity of your symptoms, whether you wish to become pregnant, your age, and your overall health. As such, it's crucial to have open and honest discussions with your healthcare provider about the pros and cons of each treatment option. Remember, each person is unique, and what works for one might not work for another. Always consult with your healthcare provider to determine the best treatment plan for you. That brings us to the end of our discussion on endometriosis. We've journeyed through the complex landscape of this condition, beginning with what it is, a disorder where tissue similar to the lining inside the uterus grows outside of it. We've explored its causes. Although the exact reason remains a mystery, it's believed to involve hormonal changes, genetics, and immune system factors. Next, we delved into the symptoms, from painful periods to digestive issues, and the importance of not ignoring these signals from your body. Lastly, we discussed various treatment options ranging from medication to surgery, emphasizing the need for professional medical advice. Understanding endometriosis is crucial, especially as it affects 1 in 10 women during their reproductive years. If you or someone you know is experiencing symptoms, seek medical advice promptly. Thanks for watching. Remember to subscribe to Braintainment for more enlightening content like this. Until next time, stay curious and keep learning.